automatic refills, annual reminders to see your prescriber so you don't pester them, when you're running out on a Friday night or on an evening, I'm not on my birth control, and you're freaking out, the doctor's freaking out, it's all freaking out. So we're trying to prevent that stress, lower, and get what we call Pandia, peace of mind. And then if you need a prescription, it's just $25 once a year to use our expert birth control doctors. And that's where my background comes in. MIT, UCSF, Stanford.
Wait. Hold on. Because I actually want you to go into that a little bit more. So just really quickly, it's $25 once for the whole year.
And to use our doctors, and we give you 364 days of unlimited questions about birth control answered by a doctor. It's not by video, it's not by phone. You just get on our secure HIPAA compliant system, type in your question, and then it's routed to the physician, and the physician answers your questions.
Well, I mean, I think that, to your point earlier, you really are making women's lives easier, and you're doing it at a very affordable rate as well. Like the time it takes to get to the pharmacy, to try and call your doctor, to try and figure out all of these things, you're actually giving yourself back the gift of time for $25. The course.
I love it.
I think that's really important. But more importantly, actually, I would really love for you to go through your background, because for everybody watching, I want you to know the first time that I heard Sophia's background, I was just floored. And so on top of everything that she's already done and that she continues to do in her life, she's also doing Pandia Health. So please, can you explain why you are the expert here?
Yes. So, I've always wanted to be a physician ever since fourth grade. Being Asian, haha, you get to be a doctor, engineer, etc. And I chose medicine because I love people and I love science. And I know that I can help people with knowledge and science. And so then went to MIT, which, as hopefully people know, is one of the top universities in the nation, studied biology for anybody aspiring to be a physician out there or an entrepreneur. And then went to UCSF, one of the top medical schools in the world. And I'm a Californian since kindergarten, and I love California and I love UCSF. It is the best. Such smart people. Professors there were amazing. Then went to Children's Oakland, where I did my pediatrics residency, 3 years. And then I did another 3 years, doubling my residency, to do a fellowship in adolescent medicine, what we call sex, drugs, rock and roll, a little acne, and some sports medicine. And then I had to get all the degrees in the Bay Area. So I went to Berkeley and got a master's of public health, so that we call that the MBA of medicine. And to be a surgeon general someday, which is maybe on my bucket list, I would love to be the first surgeon general to say masturbation or birth control, but mainly masturbation, without being asked to resign, which is unfortunately what Bill Clinton did to Jocelyn Elders, the first African-American surgeon general, because it wasn't like, and I wouldn't be like masturbation. It was, how do you prevent sexually transmitted infections? And she simply included in the standard abstinence, condoms, and she threw in masturbation, which made sense, right? And my joke is Clinton, of all people, could have used a little more masturbation. But and then from there, sorry, I had to throw in all the institutions. I'm at Stanford, where I'm a clinical associate professor in the Department of Pediatrics in the Division of Adolescent Medicine. And I've served on the Society of Adolescent Health and Medicine, Northern California, as president. I've served on the American Academy of Pediatrics section on adolescent health, executive committee. I just, love sharing what I know with others so that others can benefit, because as an academic, we don't believe in keeping it to ourselves. We believe in sharing it with everybody so everybody can get the best possible care. And so what I do want to say is that rarely do you have an academic doctor decide to let go of academia or take a little break from academia and do a startup. And I've spent the past 6 years just doing the birth control pill. Everybody else has been doing COVID, runny nose, blah, 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 etc. Yeah. I've only been doing the birth control pill. And I realized what I was taught at these academic institutions was great for a Caucasian female that wants to bleed every month. But for anybody who doesn't fit that, Asian, Black, doesn't want to bleed every month, there's a better algorithm, a better way to prescribe birth control. So I took all the birth control pills. So one, everybody out there know that there are 40 different birth control pills. And if you don't like one, there's 39 others you could try, or at the very least, there's 8 or 9 different progesterones, depending how you count it. And if you don't like one, there's 7 other progesterones out there that could be good for you. And I rank them from most likely to make you bleed, least likely to make you bleed, most likely to give you munchies, least likely to give you munchies.
Oh, wow.
And then optimized it. And with this optimization, we have 82% retention at a year for newbies versus 55%. Because if I put you on a pill, you got no side effects, you're like, yes, this is awesome. And that's what we hope to deliver to all of our customers. So $25 once a year to use our expert doctors to use this special algorithm.
Well, I'm so curious if you can dive into the algorithm a little bit more. So you talk about, white Caucasian female who wants to bleed every month. It's an option to not. I mean,
yes,
can we talk about that?
That is my passion. Hashtag periods optional. And here we go. Do you see my cuterus here?
I do.
The uterus is cuter. The uterus is happier if it doesn't have to bleed every single month. And I realized getting pregnant with my first child in 2005 that the only reason those of us with uteri bleed is we build up that lining and we're like, embryo, oh, no embryo, bleed. And then we build it up again. Embryo, no embryo, bleed. And every time we build it up, we risk endometrial cancer because it can mutate. Anytime you grow, you can grow out of control. And then every time we pop out an egg, that is a risk of ovarian cancer. And so we're doing this 300 times to 350 to 400 times in our lives, versus what is natural is only 100 times. And this is Dr. Beverly Strassman. She is an anthropologist, studies the Dogon tribe in Africa. They die the same time we do, so we're comparing apples to apples, but they only have 100 periods in their lives. And the reason why, they have 8 children. We have 2. They breastfeed for 12 months. We breastfeed for 0, 3, 6 months. So they are incessantly pregnant or breastfeeding. We are incessantly bleeding. And so if you're not trying to make a baby, you don't need to be doing this building, sloughing, hormones up, hormones down, hormones up, hormones down, popping an egg. But mainly for me, the bleeding. I don't like the bleeding. And I look back and I'm like, how did we get through high school? How did we get through college, advanced education, life with random blood 1 week out of 4? Because the whole thing with the Dogon tribe is how many periods you have when you're pregnant? 0. How many periods you have when you're exclusively breastfeeding every 2 to 3 hours? 0. So they have 100 periods in their lives. We have 350 to 400. We have enough periods for 2 to 3 other women. And they have no ovarian endometrial cancer. We have ovarian endometrial cancer. So by having fewer periods, it's actually more natural. And it's a hard concept because we as physicians have drilled it into women's heads. You must have a period every single month. Yeah. And for any teenagers watching, you can have whack periods for the first 2 years after your first period. But like after let's assume you get your period at 12, once you're 14, they should be regular. However, the new message, the 2020, 2023 message, is that we now have the technology to make periods optional, and it decreases your risk of ovarian, endometrial, and colorectal cancer. It decreases your risk of anemia. And the number one cause of missed work and school under the age of 25 is bad, evil period. So another hashtag stop sucking it up. So if you have bad, evil periods, please see a doctor. We have technology for that. You shouldn't be suffering. Whenever I give a talk, 10% of the women will come up to me, even in a room of CEOs. 3 out of 30 will come up and be like, oh, my periods are so bad. I just lie on the ground and I want to die. Like, should I tell my people, or should I hide it, or should I share it? As a woman, do I demonstrate the pain of being a woman, or do I keep it to myself and be macho, blah, blah, blah. And I was like, why are you suffering? Please see a doctor. We have the first line treatment is simple. Ibuprofen, 600 milligrams with food, assuming you don't have any kidney problems or ulcers, up to 3 times a day for 5 days. And failing that, then something hormonal. And we can make your periods lighter at the very least, if not off.
Well, so I have another question for you, because I think that probably most of our viewers and people that will come back to this might be a little bit older, have had their periods for years, might have young children or nieces or cousins. Like, how do you talk to moms? How do you talk to women that are thinking about this for their own children? Because I feel like we've also grown up with a certain mindset or education, and the idea of using technology to alter that behavior could get a little scary. How do you think about that?
I think the fear is always the unintended consequences, right? And so we have had experience with the pill since the 1960s. So that's like 60 plus odd years, greater than a lot of ours lifetimes, that are current, not lifetimes, but for a lot of us on this earth, we're under 60. But there are people above 60, obviously our parents and grandparents and whatnot. But so we have experience and we have knowledge. The main risk of going on the birth control pill is a slight increased risk of breast cancer. But in the research, the decreased risk of ovarian, endometrial, colorectal cancer outweighs the slight increased risk of breast cancer. And the risk of breast cancer goes away once you come off. But again, it's a risk, risk reduction, risk benefit analysis you have to do. As an Asian American tiger mom in Silicon Valley with two teenagers, I can ask you and propose to you, is your daughter going to do better on the SAT bleeding or not bleeding? On her finals, bleeding or not bleeding? On her speech and debate, bleeding, not bleeding? Robotics competition, bleeding, not bleeding? And the example I give is MIT pre-med biochem final, all of a sudden, bleh, and I'm like, do I run to the bathroom? I feel the blood, it's leaking down my leg, or do I finish the exam? And you know the answer if you're a diehard, tiger mom, pre-med, cutthroat, you finish the exam. I look to my left, I look to my right, two dudes, two people without uteri. Not a care in the world. They're just doing their thing. And I'm like, and in retrospect, 1 out of 4 people with uteri in that room was bleeding that day.
Yeah.
Like, that's an unfair advantage. I want my daughters to be on the same playing ground, level playing ground. And there's already enough drama during I have 13 and 16-year-olds, adolescent years, and junior year in high school is crazy stressful. And so the birth control pill is also good for acne. So helps with acne, helps smooth the up and down hormonal psychosis, takes away the 1 in 4 risk of random blood. And at the very least, if you want to bleed every month, I don't know why, but if you do, if you're on the pill, patch or ring, it makes it lighter. And to explain that, I'll bring the baby uterus here. Every month, your lining goes up to fill like a level 10 here, right? To catch that embryo, to grow it for 9 months. But on the pill patch ring, we know you don't want to get pregnant. So we just grow it to level 1. And so when you do bleed, far less blood, as I like to say. I had been on the pill for so long and I came off to get pregnant. And when I came off, there was so much blood. I was like, how do women deal with this? And I think also our family runs bloody. So we're just like, some people will do like a 3-day period or 5. Ours goes on for 7 days. It's just like blood. And so there are bleeding disorders that make you more clotty. There are bleeding disorders that make you more runny, as I say. So just, all the stuff that goes on top of it. But diabetes, asthma, acne, depression, PMS, anything with menstrual in it, gets worse with menstruation. And if we take menstruation out, no longer do you have PMS, no longer do you have PMDD. And people with polycystic ovarian syndrome, 1 out of 10 women have this. And so blocking ovulation decreases your risk of ovarian cancer, but also decreases the risk from polycystic ovarian syndrome of all these cysts in there that can twist up and then you lose your ovary. So better not to ovulate for the people with PCOS.
Sophia, I have another question for you. And maybe this is, how do you talk about it even in your circles at Stanford, in the medical community? I feel like there's also this stigma with birth control, especially for girls of a certain age that are getting their period. Well, I don't want to put her on birth control because it's going to make her more sexually active. Like, that's kind of opening the doors to this. And I understand it's a more traditional mindset, but is there a marketing or a branding issue or possible opportunity with birth control when you're talking about it in this way, in terms of, periods optional and the benefits to women in the long term?
Yes. So it's exactly that. It's not a marketing play, but it's a way to open the door that, and I really think we need to rename birth control, that it isn't birth control, it's hormonal treatment. And that's how people approach it. Because again, the number one cause of missed school and work under the age of 25 is painful or really heavy periods. And the number one cause of anemia, if you're feeling tired, cold, your heart is beating fast, you're extra pale, under here is extra pale, is your period. And you don't need to bleed unless you're trying to make a baby. And most people are not trying to make a baby from age 12 to 26. Then they pop out two, and then until 50, don't want any more babies in our house, no more babies. And so presenting it as, do you want your daughter on a level playing ground? Do you want your daughter to have a lower risk of cancer? Do you want your daughter not to miss school? Because when I was at Children's Oakland, when I was at UCSF, at Stanford, with lower income families, my family, you go to school unless you are dying. And we make it clear that you go to school unless you are bleeding buckets, but other people be like, oh, you can miss school. And it's like, 2 days or a week out of every month. That's 10% to 25% of her education. And even if she works her hardest during those other 80% of the time that she's there, that's a B. Your daughter will always be at a B. And whatever she misses, she doesn't know what she misses, and she won't necessarily catch up. So we need to level the playing ground that no one misses school because of your periods. And if you are, please see a doctor. No one misses work because of your periods. Again, please see a doctor. And that this has benefits of decreasing cancer rather than increasing cancer, and that this is hormonal treatment. And actually, we have to get around to it. Endocrinology friend from Mount Sinai in New York and I are going to write a paper, but anyone can grab this and write it before then. Is currently birth control pills are called oral contraceptive pills, and then these other pills are called progesterone only pills. Yeah. So our proposal is, let's call it estrogen progesterone pill. So no longer is birth control or that thing in there. Unfortunately, society has made it political, as we've seen with the reversal of Roe v. Wade. Yeah. So let's just make it what it is. It's estrogen progesterone pill, estrogen progesterone patch. It is not about birth control, because 70% of people who use birth control are using it for other reasons: painful, heavy periods, acne, polycystic ovarian syndrome to preserve their fertility and to prevent endometrial cancer, and making #periods optional.
I love that. This is really helpful and educational. And I know people in my life for whom I think birth control would be a great option for painful and heavy periods. So I'm definitely going to be taking this information back to them. Do you work with people with Pandia Health? Is it all ages? Is it for a certain type of woman, states range? Can you just talk about that a little bit?
Yes. So the hard part about being Pandia Health is we are building the online health brand Women Trust. But with this hormonal treatment, the range is huge. So you can start from 2 years after your first period is what I would recommend. And the only reason 2 years after is because I come from short Asian stock family. We're trying to maximize height. And so after you get your first period, you still have 2 years to grow height. And if you throw estrogen before then you decrease a potential 1 to 2 inches of height. So I do not want my children to lose their potential 1 to 2 inches of height. But
how tall are you, Sophia?
I'm 5'3", and my 16-year-old is 5'1", and that's as big as she's gonna get. I didn't marry tall enough, but I love my husband, and I wouldn't want him any taller. We're like the perfect height fit anyway. It's adorable. But for anybody who, like, I had one woman and her daughter was already 6 foot, and she's like, you can stop it now. And I was like, okay, yeah, we can stop it now. But if your daughter's periods are so horrible that she's missing school or she has anemia, then you can start it as soon as she gets her periods. Because as I mentioned, she doesn't need this building up and sloughing and popping out eggs unless she's trying to make a baby. And again, on average in the United States, most people are not making a baby until 26. So from 12 to 26, you have 14 years of monthly bleeding. Wow. No good reason.
Yeah.
Okay. And then pop out some kids. And then on the other side, stop it again. And in between, the WHO recommends 18 months to 24 months where you are not pregnant. You should not get pregnant for 18 months to 24 months after your first one. Not pop out a baby at 18 to 24. Wait to have pregnate with next baby to 18 months to 24, because your body needs to recover and you need the nutrition to optimize the next baby. But also give time to the firstborn, but mainly your body needs to recover nutrition wise to give the best nutrition for the next baby.
That's funny. I wish I knew that before. My older two boys are 17 months apart. So clearly I didn't.
You were a little closer. And a lot of people do that. And there's Irish twins. And my brother, I originally tried to aim to have my kids 2 years apart, but I ended up having 3 years apart, which worked out well. Because I realized in retrospect, you don't want two kids in diapers. Two different size diapers, right? It was really nice to be like, goodbye, those diapers, and just have one set of diapers. So that's our tip out there. Have one out of diapers by the time you have your next one.
Well, it's good to note. We'll put that in the notes. But sorry, so you were saying just about sort of
just that we serve from 2 years after your first period, or even your first period, through the age of 50. And I'm of menopause age, so all my friends are like, menopause, and I'm like, yes. I need to find the best menopause treatment for me. And I have found it. It is the estrogen patch. And then you either do the progesterone pill every day if you don't want to bleed, or you can do it a couple weeks and then you bleed every month. Why? And then, or you can do an IUD with hormone and leave that up for 7 years, and you don't have to take the progesterone every month if you have a uterus. If your uterus is gone, then you just take in the estrogen, and the estrogen is good for your heart, it's good for your brain, and it's good for your bones. And again, being Asian or a minority with lactose intolerance, bone is an issue. So, but also I have a family history of dementia, so dementia is an issue, and everybody has cardiac, unless you're healthy. Most people are less healthy. I love my desserts. So to answer your question, because I'm adolescent medicine, we are acutely aware of the laws in every single state. When can an adolescent consent? When can an adolescent not? We have a way for parental consent. So if you're a parent and your daughter's suffering, and for some reason your conservative local doctor won't prescribe, Hawaii, Alabama, Kansas, etc., we're happy to prescribe. And I realize I'm bringing UCSF, Stanford, grade care to wherever you have internet and a mailbox. And medicine should be practiced the same in every single state, because I've heard horror stories where a 23-year-old woman goes to her OB-GYN in North Carolina today, not like 1970s, and says, can I get some birth control? When you go for birth control, you're trying to prevent unplanned pregnancy. You're trying to prevent the need for abortion. You're trying to time your children to maximize your body. And the doctor put his hand on her shoulder. She was married, and was like, honey, don't you think it's time for you to make some babies? Who are you to tell me? My body, my decision, my body and my family, my significant other, my husband, my spouse is decision. That's you. I came to you. You do what I asked you to do, unless it's outside your practice parameters, whatever. But like, what? And then Hawaii, we've been trying to get into. So if anybody from Hawaii is listening, the lieutenant governor is a doctor, and they have a horrible teenage pregnancy problem. Well, you either need to, work on your sex ed, but they've always shown that, kids have hormones and they will do things when they're bored, or just they will. We all know we were all teenagers once. So let's give people birth control to, 1, make periods optional, and 2, prevent unplanned pregnancies. 70 to 80% of teenage pregnancies are unplanned. 70 to 80% of teenage pregnancies could be prevented. So let's give people access. If your local doctor doesn't want to do it, blame Dr. Yen and our liberal team based out of California. But we can deliver the birth control pill to all 50 states if you have a prescription and insurance. And if you don't have insurance, no problem. Most birth control pills are $15 a pack, 3-pack minimum. There is a $7 pack, but that's the one that I mentioned. Caucasian females don't want to bleed every month. Okay. Or an older person, if you're 30 and above. And because I'm adolescent medicine, we recommend 30 micrograms of estrogen until you're 30. And then after that, you can go lower. But if you go lower, it's not good for your bones. Again, focus on bones. And then we can write the prescription in 15 states. We're about to launch our 16th state. So welcome, Ohio.
Yeah.
And then we will expand as we raise more money. So anybody with money out there and you want to invest, come my way.
I love this. I think that you've given us so much important and valuable information on this conversation, just even starting with the idea of periods being optional and what birth control and hormonal therapy, you know, how it should be called, what it's used for, and also just the stats are sort of shocking. And yes, it is. It's our bodies. We should have more of a say on what to do and in what time frame. But Sophia, just being mindful of time, both yours and our viewers, I just want to wrap it up and say thank you so much for joining us. I think what you're doing with Pandia Health is incredible. It's very needed. And for all of you that have just joined or are watching or watching later, please go check them out. Pill anxiety is real, and you shouldn't have to experience it. And Pandia is solving that in a really big way. So thank you, Sophia. Keep doing what you're doing. We are huge supporters and really big champions for you all along the way. So congratulations. And I look forward to continuing our conversation down the road.
Thank you so much for bringing this to your viewers today and sharing this with the world on the internet. I dropped in the comments, pandiahealth.com/periods optional. At the bottom is my TEDx talk on the science and safety of not having to bleed every single month. And anybody who's not making a baby, who has a uterus, consider going periods optional. It's so 2020 to bleed every month. Get with the times.
Your daughters are very lucky. I'm sure you have a lot of fun at home.
We have fun conversations at home. And I hope everyone will be open with their children as well. And if not, send them to Pandia Health or Planned Parenthood or other trusted websites.
All right. With that, thank you so much. Enjoy the rest of your Thursday and talk soon.
Thank you.
Bye.
Bye.